Good afternoon, everyone.
Good afternoon to all our audience.
Hi. Hello. Good afternoon, everyone, and welcome to the 263rd episode. Welcome, Stella, of our webinar series, Health Updates. And it's great to be here. Great to see old friends on the participants list. And we look forward to a very interesting topic we're going to tackle today. So, the most recent typhoon that struck our country has displaced more than 1 million Filipinos. Behind these numbers are real lives, and families are forced to leave everything behind and are returning to find sometimes that there's nothing left for them. The urgent question is what happens to their health? Paano ang kalusugan nila? Displacement is not only about losing shelter, it places individuals and families in physically and emotionally stressful environments. And we'll talk about the different issues that arise from living in crowded conditions. We can only imagine how bad this is, and especially if it's prolonged. But I think one of the things we want to talk about is that in these situations, even health workers are victims. And when they are also displaced and their families are also under stress, it makes it very difficult to respond. Equally critical, I think, is that all of this has an impact on mental health, and we will try to unpack some of this, try to understand how it is that we are coping with one emergency after another. So this is Health Updates, our program that followed after Stop COVID Deaths. And I am Dr. Susie Pineda Mercado, your host for today. And it's a pleasure to co-host with one of the original founders also of what was Stop COVID Deaths is now Health Updates, Dr. Stella Jose. Stella, good morning.
Good afternoon, Susie.
Afternoon na nga pala. Okay, afternoon na. Okay.
Sorry. Good afternoon. No. Good
Oo.
afternoon, Susie, and hello to all our participants here in the live broadcast of the Zoom webinar, and to all those watching via live streaming on TVUP YouTube channel, as well as the UP System Facebook page, the TVUP Facebook page, and of course, all those watching from TVUP Signal TV Channel 101. At Health Updates, we bring you the latest information on health and medicine. Over the past few days, we witnessed one of the largest typhoons in history. The typhoon is gone, but we are not yet out of the woods. It is estimated that more than 1 million people were displaced, and it is fitting that we spend some time to think about what has happened and what might have happened, could happen in the future. We will have a discussion with two extraordinary professionals who have been at the forefront of major disasters. We have Health Secretary Ted Herbosa, who we all know is an expert in disaster medicine and an international expert in health emergencies, and former WHO representative to Yemen, Dr. Art Kasigan. In this week's episode, we will reflect on what this means to the healthcare system and how we can contribute to resilience as for our patients, and probably something that could potentially come up again in the future. Okay, so to set our discussion into context, let's watch this TVUP video.
Walang awang binayo ng bagyong Uwan ang lahat ng nadaanan nito.
Its wake, 1.4 million people displaced from their homes, nearly 24 million others without power supply, and 1,000 houses destroyed.
Okay, thank you, Stella, and thank you, TVUP, for that introduction. I think that puts into context what we have to talk about today. And let's get moving on the topic. So for this webinar, instead of having presentations and a Q&A, we're going to have a conversation. So we have our two experts. Our first speaker and discussant does not need an introduction. You all know him. He is the current Secretary of Health in the Philippines. He is a trauma surgeon and an expert in disasters, and he has served in many high-level positions in the Philippine government as well as in the University of the Philippines. He is internationally recognized for his leadership in public health and recently has been the head of many international global initiatives on tuberculosis, on the pandemic, and on vaccines. He's currently the president of the World Health Assembly, the first Filipino president of the World Health Assembly. And we should mention, of course, that he's one of the founders of this webinar series. So let's welcome Dr. Ted Herbosa.
Hi, Susie. Good afternoon and good afternoon, everyone. Happy to be back in
I
TVUP.
know. Welcome
Ah,
back.
Good afternoon,
Welcome back to
Stella.
your welcome back to your baby. To your
I
baby.
know, I know.
Okay. We also
Year
have
of
with us, and
2020.
yeah, okay, thanks. We also have with us another international expert who has had a distinguished career in the World Health Organization, and he has served in many places. So he has served in war-torn areas. His last assignment was as WHO representative to Yemen just last year, but he has worked in Timor-Leste, in Indonesia, in India, in Japan, and in many other places. He started his career also in disasters, and I think and Ted were also together in some kind of a course together. Anyway, Dr. Art Pisigan. Art, welcome to the webinar.
Hi, good afternoon, everyone, and thank you very much, Susie. Hi to Stella. And I must say, it's really a privilege to be joining this program, especially with Secretary Ted Herbosa, who's been a very good colleague. And as you mentioned, that we were together in the first WHO training on crisis management and health emergency management in
So
Geneva.
you were together, let me understand this. You were together in training. You were being trained on something. This was a long time ago, right?
Yes, this was in
Yes,
Geneva in
quite some time.
1994.
Oh my
94?
goodness, I wasn't born yet.
Probably,
19
I think it was 94 or 95. We
yeah.
we
1994.
lived in the barracks of the Swiss Army officers. We lived
Right.
in the barracks and we
Civil
stayed in
defense.
Geneva for more than a month. We did
Wow.
training in the Versoix Office
Yeah,
of Civil Defense.
France.
They
Yeah, wow.
Versoix, and
Sean.
there was like a simulation center for collapsed structures, and there
Uh-huh.
were classrooms, and we had all experts from all over the world, from the CDC, from the EU, from the military. But it was the first time WHO put together a diploma course on emergency and crisis management. At that time, the EHA, it was called then Emergency Humanitarian Action, had big disasters everywhere. And I think the 1990s was the UN International Decade for Disaster Reduction.
Decade.
UN Decade
Yeah,
for
and
that.
Yeah.
and for the Philippines, I remember, Art, we were I'll bring Stella into this conversation because Stella and Ted, you worked together also in PGH, no?
Yes, of course, yeah.
Yes. So I mean the at that time, Art, we had
Bicol.
big
It was a
earthquake.
Bicol. Yeah, and the
We
earthquake.
had the big
Yep.
earthquake, the Samar, the Leyte, Ormoc flood,
Then we
Ruping.
also had the
Oh my
earthquakes in
goodness.
Nueva Ecija and Baguio, and we were actively engaged with environment and also with church-based interventions
Actually,
for support.
Susie,
Yeah,
Oh,
the story of that scholarship was they went to the Philippines, the EHA, Dr. Samir, who was there,
yes.
a
Yes,
Tunisian,
I remember Samir.
because he
Ben
was
Ahmed.
so impressed with the project we implemented in DOH. Remember the Stop Death program?
Yeah,
He was so impressed because with the Stop Death program, we modified from a disaster management unit. We converted and used all the resources of all hospitals,
correct.
emergency departments, CHDs, and then converted it into a big program. So the Secretary General of that program, Stop Death, was Manny de Guzman, Manuel de Guzman, who
Right.
became our Secretary for Climate Change
Correct.
Commission.
Yeah.
and also was formerly OCD, Office of Civil Defense. And then, of course, kasama ko, I was the Deputy Secretary General for Technical Concerns because I had actually come back from training from Israel at that time when we developed the Stop Death program. I learned all my disaster medicine in Israel, a country in a state of war for like 50 years. And then eventually we developed Stop Death with little resources. The WHO was so impressed. So they got us for the scholarship on their first course to put together all this knowledge. Si Art was in the public health, College of Public Health, and he was delving into training for public health disaster response. So
Yeah.
nasama siya as the academic in the group. So there
Mhm.
were three Filipinos there. Ako became Secretary of Health. Art ended up working in WHO for many positions. And then Manny de Guzman went over to climate change, became OCD director for one time, Office of Civil Defense, the one in charge of our national disaster risk reduction, and then eventually became Secretary of Climate Change. So
Yeah.
very interesting course, huh?
Yeah. Speaking of course and training, Art, you want to talk a little bit about before we go into the topic, no? Because while we're kind of
Yeah,
trying to
sure.
find out who's the cousin of who here, right? So, tell us a little bit about training of doctors, nurses for disasters, because the audience of I'm gonna say Stop COVID Deaths, of health updates, direct, sorry, ano, bago ng pangalan, of health updates are mainly doctors, nurses, health professionals. In fact, you'll see on on the list of participants, we have, our always attending faithful members of the community from Saudi Arabia, from Taiwan, from so many other places, no? But I think given the number, and we'll talk to Ted about this later, given the what should I say, consecutive disasters that happen. Of course, this has an impact on delivery of services. So, Art, when you were doing training for health workers, what were the
Professionals,
main
yeah.
things that we had to focus on? What do you focus on when we're preparing people? And Stella's also been involved in training, no, in responding to disasters. What are the main things that we have to emphasize?
Yeah, basically, and I think Ted brought that up. And when it comes to being able to deal with trauma and also the physical impact, that's well developed, and Ted has really worked a lot, particularly for the development of the trauma units in the country. So there was a gap in terms of the public health component. And we talk about public health, these are usually the more silent ones, the ones you do not see, but you need basic water sanitation, your immunization, your public health services, and the management part of which many people in health have not been trained,
Yeah.
the health management component. So that's why we found the necessity of creating a program, and through the support of Stop Death, we're able to have postgraduate training. We started it in the UP College of Public Health. I was fortunate in handing also the doctors to the Barrios program before. So we had a strong module on health emergency management too. And that has evolved. And even the initiatives, let's say like from Bicol University also started a master's program in health emergency management. But we'd still want to see that kind of effort. And probably the gap right now will be being able to see how the community will be involved and how local governments will be tooled and skilled to be able to better management the health components of any health emergency preparedness and response program.
Yeah, thanks, Art. And later I'm gonna ask you, Stella, no, about delivering babies in an evacuation center. But Ted, tell us a little
Yeah.
about what the situation is now. Do we still have a lot of people who are actually displaced and in evacuation centers?
Yeah, there's a lot less people than it was during the height of the preemptive evacuation. Because I looked at the video. The video said Typhoon Uwan, but actually your images were mixed. They were mixed with images of the effects of Typhoon Tino and Typhoon Uwan.
Okay.
Now, Typhoon Uwan was a super typhoon when it was developing in the Pacific Ocean. So there were a lot of warnings, and Typhoon Tino had just hit with about 180 deaths. So people were sensitized. So they were like a week apart. So because of that, we were still responding to Tino activities, to Tino victims, which had a lot of deaths because of flash floods from rainwater. So Tino killed many people from the rush of rivers that swelled and shanties that were placed in what we call river banks, and then mud that flowed from the mountain into the watershed area of Liloan, Talisay, and all that stuff. So that's what killed many. And they were not prepared because the warnings were not there, because it was just a regular typhoon, regular typhoon. It just happened to have 200 millimeters of rain in 2 hours. That's the amount of rain in 1 month
Year.
poured in a
Wow.
place in two
Rainfall,
hours.
hindi yung storm itself, but the
Hindi
rainfall.
siya storm. And then when super Typhoon Uwan was coming, the effects of Tino were already visible. Many dead, homes were destroyed. People were told to do preemptive evacuation. They immediately went on preemptive evacuation.
Yeah.
Over 1 million went to this evacuation centers. Then the typhoon came. It was a super typhoon when it hit Catanduanes, but the moment it hit the Sierra Madre Mountains, it dissipated into a regular typhoon. Humina siya. And it still brought some damage to Casiguran, in Quezon, Aurora, and other parts, but it wasn't as bad as the damage of Tino. So you can see here another principle in disaster medicine. Your hazard or your event can be a super typhoon, yet that does not kill as many. I think we killed only 8 people at that time, mostly from effects, compared to the 180 of Tino. Yet one is a super typhoon and the other is just a regular typhoon. So very interesting. And then there's the fact that these are magkasunod, they are sequential.
Yeah.
I've been in the Philippines for a long time. Sequential hardly happens until the most recent times.
Yeah.
So this sequential of meteorological events na magkasunod and both strong are very interesting events. And I think that's where we go and delve into talking about climate change. So yun yung unique na nakita ko dito, no? The setting is changing. The other thing is we were talking about training. People are now more well prepared. I mean, the LGUs are now more well prepared. From the time we started with Stop Death, and then the law was passed. Before at that time, it was only the National Disaster Coordinating Council, which was just a mechanism for response and relief. So you only activate the council when there is a response
Yeah, and
after
it was actually
Yes.
a funny name, right? Because it was called the Disaster Coordinating Council. It's
council. Yeah,
coordinating. It's
correct,
like
correct. You coordinate
coordinating
the disaster,
disasters,
which
right?
was
So,
actually a very
I
accurate
think
name, actually.
Secretary Ted,
Stella,
I think because of the frequency of typhoons, no, it's really
nawala ka,
dapat
Stel.
meron tayo. Oo, dapat may ganun eh. Kasi it's all, parang nagugulat lang yung mga tao, but it's always there. If you count how many typhoons we have in a year, ang dami.
So Stella is now discussing another part of disaster medicine. This is how to interpret the data that people have. We now have accurate data. We have accurate information. We could predict how much rainfall that
Yes,
and in fact, if
we
you
can
go to
compute
UP
that.
NOAA, you will see the path of that flooding
Yeah.
na masisimulate ng NOAA yon. So the data is there. The problem is are our local chief executives using the science? Are they using the data to interpret it for their specific area to actually create an appropriate response? It's just like going to a doctor and the doctor will tell you he'll have a lab test in front of him, but he won't discuss you every detail of your CBC, chemistry, ECG, and all that stuff. He'll just start to give you recommendations based on our
Yeah.
Yun yung wala. I think the analytics of the data is available, whether it's ano yun, Hazard Hunter of DOST or UP NOAA. We have so much data and they're accurate. Meron pa nga on the internet, JWTC, all this Japan, Australia, US, they all have this data on meteorological events. Yet, people do not know how to use and interpret these maps, this data into actual response. That's
Right.
where the gap is.
Yeah.
We
Yeah.
have local
Let's
chief executives who do not understand and how to read. So we need scientists, we need UP, we need other scientists with knowledge to say, "Huy, malakas to, mag-preemptive evacuation tayo, super typhoon to, 250 kilometers per
but
hour."
Ted, that actually happened right now. It
Yes,
actually
yung pangalawa, but it didn't
let's
happen in Tino.
it did not happen in Tino. Let's pivot to the health part of it, right? So Art, let me ask you. What are the more obvious health concerns now? Babalikan natin yung TED, babalikan
Yeah.
natin yung preemptive tsaka yung using data and science as Stella has been saying. But let's talk a little about evacuation and what are the more obvious effects on health. Because right now, if I'm not mistaken, Ted, you still have a lot of evacuees in many places in the country, including Filipino,
Congested.
and
Congested ang
congested
evacuation
areas.
center.
Oh, sige. Art, ikaw, what do you think are the more obvious from a public health point of view? What are the more obvious issues here?
Of course, especially with the recent emergencies that we've had, the most obvious are the ones that have an impact on the physical aspects. So you have
Okay.
the injuries. So you may have fractures and problems of that sort, or your wounds, lacerations and things like that. Then in the existing community, because of the cold weather and also ventilation, then you would have your upper respiratory tract infection. And of course the needs of the health of children and the pregnant women,
Yeah.
which are always very visible and you see. But the thing that we would want to look into would be and the concept of being invisible. And when
Mhm.
we talk about invisibility, what are those that we are concerned with? And I want to relate that also like with my experience when I have to ask for support like from partners. I always have a very difficult time to ask support for mental health and psychosocial support. But mental health and psychosocial support begins even before the emergency happens. So that communication issue is very important because it allays fear and also is an approach ready to psychological first aid. It also, and I think that we have to go back to what Ted was saying, that we have to be science based because science will tell us what are the facts and what is the evidence and not be under misinformation. So yung mental health and psychosocial service is important. And for me, you don't have any argument anymore. It starts from day one that you have to have services in your evacuation center. Because for many people, they do not see na, I mean, like a lot of them are affected and are quiet, and the people who are depressed or stressed, so they're not going to be very
Yeah.
visible.
I
Yeah.
remember, Art, I mean,
Oh,
it's not unusual in the evacuation center, mga tao tulala. But
exactly.
I wanna ask Stella something because I remember, and Ted, you remember this in Hayan, right? Um, Women suffer an what should I say, a greater proportion of responsibility because they have to take care of kids, right? But I remember in Hayan, Stella, no, one of the things that they needed, they were, Ted, you remember this, no, yung mga ibang tao, inalagay sa C-130. Tapos they fly them all the way to Manila. When they get to Manila, one of their problems,
Oh,
which was for many days, they had no sanitary napkins. No, and you had babies who had just been born, who had nothing, no food. The relief food is sardines and or young toddlers, right? The relief food was sardines and noodles and ano naman makakain ng toddler doon. So, Stel, can you say just a little bit about mothers
mhm.
and pregnant women and lactating mothers who are
Yes.
caught in evacuation sites?
Yes, that's the problem, no? So, that's why we want to promote breastfeeding, no? Kasi
Mhm.
pag breastfed, hindi mo na kailangan ng mga maraming tools pa. You know, just the mother's breast is already enough for the baby, and that will sustain the baby. The problem is they are attached to formula. Ayan.
Yeah.
Kasi it is faster. You just, just titimpla mo lang, andyan na kaagad. But
Eh, pag
that
walang
is not
tubig, paano?
healthy, no? Oo, yung tubig
Walang
pa baka
tubig.
marumi. So,
Paglinis.
That's one of my advocacies, yung breastfeeding. So in PGH, that's what we promoted talaga. So no formula and no bottle feeding in PGH. And I also know in other hospitals, it's also like that. But when it comes to disaster, ayan, dyan na nagiging skewed. Hindi na natin masabi what
Yeah.
their actions will be.
So, Susie,
Oy, Ted,
today,
yeah.
after the experience of yan, yung kinukwento mo, today we call
Hygiene kits.
yung hygiene kits. The hygiene kits include the sanitary napkins because we
Yeah.
found out yun yung problema ng mga women. So the DOH and DSWD gives out hygiene kits. Makikita yun. Yung hygiene kits may timba, may tabo, pangwash, may toothpaste, toothbrush, sabon, at sanitary napkins.
Yeah.
So that's a very important lesson we learned. So ngayon lahat, tapos yung food ngayon, food and water, naka-package na yan. Tapos we use stuff that are developed, may yung rice mongo na ready to eat,
Paano yan?
RUTF.
Paano si Rice Mongo? Paano yan?
Ginawa ng ano yun eh, ng FN, ng DOST. So that's in the package already of you'll go to the Google, you see Secretary Rex describing what's inside that box. It's
Yeah.
for a family of 4. So it's good. So yan, yung minamanufacture na nila yan. Dati nanghihingi sila ng volunteers to put them in ano tawag dito, shopping bags na plastic. Ngayon they're in cartons and
But
they're
is it cooked already or you have to cook it?
ready to eat. Ready to
Ready
eat.
to eat.
Most of
Okay.
that, you open, you eat it. Mayroon ng pagkain.
Very
But
good.
we also put up now hot kitchens. Kasi,
Yeah.
you cannot survive on this ready-to-eat meals if you
No,
eat it
no,
3 times
yeah.
a day. So, we put up what we call kitchens, rolling kitchens. They're trucks with a kitchen.
Okay.
So, they
They
serve hot
serve
meals.
hot meals.
They
So,
serve hot meals.
oh,
Tapos yung mga disaster sites ngayon, may kitchen na yan. I've
okay.
visited them. So if you go to a school or to an evacuation center, merong part na kitchen. The LGUs already know that mas mura yung ganon, namamalengke sila,
Yes.
magluluto sila ng food,
Yes.
all the evacuees in an area. So nag-i-improve naman tayo.
Yeah.
But I think there is still a lot of improvement to be had to be done kasi umikot ako. I went around. I saw a woman. Sabi ano kailangan nyo? She was a mother with a 3-month-old baby. Bottled milk ang hinahanap niya sa akin. So sabi
Oo.
ko, teka muna, hindi ba tayo nagtuturo ng
Yes.
Yan
breastfeeding?
ang
Meron
sinasabi
palang
ko
bag.
eh.
There is now a bag for breastfeeding
Very
women.
good.
Sabi ko, in-explain ko sa kanya, alam mo, delikado
Kailangan,
yan, magtatai pa yung anak mo kasi the water
yes.
is not fine. Saan ka mag-sterilize ng bote? Wala ka sa
Oo,
water. The
exactly.
women do not understand that. Akala nila, hihinto sila ng breastfeeding pag nasa evacuation center sila. So,
Yeah.
kailangan pa rin we still need a lot of
Education.
education.
Oo,
Oo.
Yeah, I
exactly.
mean, of course, if you have a breastfeeding program in an evacuation site, it will encourage women to
May bag
breastfeed.
kami. So we give away this bag.
Oh.
It has a breast pump. It has
Pero,
all the panlinis ng nipple. So it's
pero,
also a
Ted, pag
Pero sandali,
sinabi
let me say
naman,
something about that yung breast pump. Kasi
oh,
when you use a breast pump, you have to transfer it to a bottle. Kaya mali siya.
yun.
Ted.
Okay.
dapat
Kasi
pag mag-breast
ita-transfer mo
pump,
sa bottle, edi ganun din bottle feeding din yun.
Kailangan ka rin ng
Kailangan direct latching on.
touching on, tama. Ang
Yes.
akin naman, paano ka naman mag-encourage, pag siksikan yung mga tao, biglang magtataas ka na lang ng,
Huwag
you
mo
know,
taas yung
there's got to be,
vlog mo, Susie, ha?
there's got to be some
Wholesome
privacy.
show ito.
Oh, di ba? There's got to be some privacy.
Exactly.
Kailangan merong parang
Hindi,
curtain.
nilalagyan nila ng
May corner
towel.
pa or
Nilalagyan
room.
nila ng towel yung breast nila to hide the
Oo.
breast. Hindi naman yan naka-expose na ganun.
Oo nga, kaya nga,
The
pero pag
point is,
siksikan,
oo.
di ba? Parang,
Oo, sabagay.
it's
Totoo.
not a privacy thought. Anyway, Ted, talk
Yeah.
about water. Talk
Okay.
about water. Kasi, parang, yeah, we can talk about all the different services, but let's go to the very basic
So
things.
that's
I'm
what
gonna
the first
start
thing we
also about,
teach.
sige,
The first
tubig
thing we teach in disaster medicine is the human being cannot survive more than 24 hours without water. So one of the first things that a disaster response should think of is potable water. The next one is we call the toilets, no? Because when you put a lot of people in one site, where will
Yeah.
they do their toilet? They cannot just go to the bush and they'll do it. So importante to build and put up mga latrines and portable toilets. So very important yung two, and that's considered together, put together, that's what we call the wash sector of response. And it's the priority, wash and nutrition. Yung dalawang yan, very important. Water, sanitation, and hygiene. Potable water, ito merong issue recently. Parang there was this pediatrician na kinikriticize niya yung DSWD filtration system.
Aha.
May comment ako dyan. Hindi niya naintindihan ang principle of disaster medicine of changing level of ambition. You know,
Yeah.
where many people have survived shipwreck, they drank their own urine because they're in seawater without any, or they drank rainwater. Hindi sila namatay, pero they drank dirty water. So, ang tinatawag ko dyan, in disaster medicine, that's called changing the level of ambition. Hindi ka maghahanap ng the same pure potable water when there is none. What is important is to provide at least filtered water. So ito yung binibigay ng DSWD. It's like a timba. It's got a tube with a mechanism from Waves for Water that actually filters up to 1.1 micron. So madami na siyang mafi-filter. Whether iinumin mo ba yon? Oo, iinumin ko yun pag walang ibang tubig mainom. But
Correct.
is the potability of that water comparable to the potability of what we say the public health standard is? Maybe not.
Yeah.
But your level ambition changes because the setting is if you don't drink that, you'll get
You'll die.
dehydrated. You'll die.
Oh, you'll die. Correct.
So I'd rather be
Dehydration.
alive with diarrhea because I can treat
Oh.
your diarrhea.
Yeah.
I can rehydrate you or I can give you antibiotics if you start to have diarrhea. But at least you're alive. So yung question na yan, no, mali siya. He's going into a wrong direction by trying to criticize kung safe or not yung water. It's not about safety, it's about survival muna. So ito
Yeah.
yung mga hindi nila naintindihan. Like, when I teach this in the academe, when in disaster doctors, if you're on the top of a mountain and you have three people injured in your situation, one with an injury, one with a bleeding, internal bleeding from splenic fracture, and then one with a femoral shaft fracture, and it takes you 1 day to bring them down the mountain, who will you save?
Ako. Trick question yan, ha?
Oh, because
Yeah,
people
true.
always in the emergency room, I will save all three.
Yeah.
Because I can do neurosurgery and CT scan for the head injury, do emergency operation for the splenic injury, and then call the ortho to fix the fracture. I can save them all in my setting in the emergency room.
Right.
In the top of the mountain, if I try to bring down the head injury, even if I bring him down after a day, he's probably got Glasgow coma 3 already.
Oh, so
He'll
sino
die.
ibababa mo?
Then the two others, ang ibababa ko doon yung femoral shaft fracture.
Okay.
Because that will survive
May chance of
surely with the
living.
travel of 1 day.
Okay. So,
Yung patient na may hemorrhage sa spleen, kahit ibaba ko siya after 24 hours, pagdating niya doon, he's died of hypovolemic shock. The other head injury has died. Now, people look at this and they say that's playing God. No, it's again science. So ito yung mali ng mga tao. There are three basic principles in disasters. One, you prioritize. We call that triage. Alam ng lahat ng doktor ang triage. Prioritize who is the most serious. Second, mobilizing resources. It's a logistics thing. Who can move the logistics to the place where the people need them? So you match the needs with the demands with the needs with the supplies. And the third is this one, changing your level of ambition. To all the
Yan.
doctors, and madami tayong doktor at health workers dyan, Kingdom of Saudi Arabia, tinitingnan ko kung iba't ibang bansa. You change the level of vision. This is what we learn in the Philippines. Your setting is the most important. Working for a patient in the ER or the OR is different for waking in the patient on the top of a mountain or an
Correct.
evacuation center.
oh, so
Change your level of ambition.
oo.
So risk ang hinahandle namin. Risk of death or risk of illness?
Kaya,
Unahin mo yung
ang
risk of
lesson
death.
dyan, Ted, kung mamimili kang injury na lang broken bone, di ba? Huwag ka magpapatama sa ulo. Okay, let's go.
Kaya di ba pag nag-evacuate sa earthquake, ganun ang
Correct. No,
sinasabi?
but
You hold
from a
your head
practical
and
point of
protect
view,
your
right?
ulo.
You protect your head and you protect your torso, hindi ba? Okay, wait. Let me go to Art. Art. So
Sure.
sabi ni Sected, reduce the level or bring down the level of ambition. All right. What do we know about what can be done for potable water in situations where you just don't have bottled water or jerry cans or whatever. In your experience where you have worked in disasters, ano-ano ang mga ginagawa para pwedeng inumin yung tubig?
May technology na actually that, and I think those that have been mentioned by Sected are very practical technologies that can be done and are cheap. Now, you have various approaches to that, knowing what your logistics capacity would be. So if your logistics capacity would be able to bring you also bottled water into place or pumping and bringing it there depending on the environment. So it's really, there's the science to it. Now you have the, and these are not exactly in the purview of health, but more of like us insisting on the people, so public works or social welfare to ensure that our job perhaps also would be to show that testing the quality of water, that there is a mismatch and this is what we should do and insist on that aspect. But for us to rack our brain of getting water and stuff like that, it's another sector that probably should be doing. Ours would be ensuring that there's quality water. But there are various technologies and we've dabbled into that. There are various costs into it. But the important thing is to get that supply there. Fortunately, with what I have seen lately, we've not gone to that extent na super toxic, and I think there's still a possibility of all of those being pumped in. And I definitely agree with Ted. But we also have to have like a certain ambition too, and that's also with the science that we knew that, for example, like in Heian, only 20% of the evacuation centers had good wash. We cannot live on 20% wash standards now. So we have to raise our benchmark for that.
How
We
about
have
chlorine tablets? How about chlorine
Oh
tablets?
yeah, no, definitely basic. And that's, for example, when you talk about your interagency emergency health kit, chlorine tablets are there. If you don't have chlorine tablets, then you can use your hypochlorite solutions from your basic bleach solutions
Oh, pero
that you
yung
use.
bleach, you have to put
Oh.
only a little, di ba? Kasi pag marami, iinumin mo yung may bleach. Di ba? Konti lang yung nilalagay doon.
Ang medyo toxic do sa bleach and things like that would be like the proportion. But it's a lot easier already and it's ang dami ng mga tablets that you can use for disinfection. And
So,
I think that one is like really getting the basic lifeline of the supply would be the basic issue that you should have and demand that from the other sectors that should bring
they
us.
should also
Oh,
prepare. Stella, I think we have some questions. Naku, ang bilis ng oras. We only
oo
have
nga
10
eh.
minutes left. Sige, Stella, I think
Uh,
we have questions in the chat.
yes. Wait.
Ito.
Okay, so there's a question from Dr. Joseph Tortona. Are
Yeah.
the relief goods like the food and supplements given to typhoon evacuees FRNI approved? So,
Yes. They actually use a lot of them are used by the technologies developed by FNRI. But there is no such thing as FNRI approved. FNRI is Food and Nutrition Research Institute of the Philippines. They're not a regulator. So it's
uh,
FDA. It's actually FDA that
okay.
approves whether the food is to be
Uh,
sold for
so,
human consumption or not. So
Dr.
the question
Joseph,
is kind of medyo off, pero tama siya. If he thinks yes, certified lahat ng binibigay ng DSWD and
uh,
this
the
is
next question is, how soon are evacuees provided psychological help to mitigate PTSD?
immediately. So all of our responders are trained in what's called psychological first aid. If he equates mental health support to having a psychiatrist, no, not immediately. In fact, naalala ko even before the crisis, we actually helped our Filipinos that were in Tel Aviv during the bombing. During the bombing in Tel Aviv, nag-Zoom and we had small rooms and we got the psychiatrist from National Center for Mental Health. So the key in disasters for mental health is identifying high-risk individuals, the people you work with, yung namatayan, yung nawalan ng farmland, yung nawalan ng bahay. All of those are suffering from depression and anxiety. So sila ang kailangan ma-address, yung very young, the children. Naalala mo yung nasa video? There were two kids
Yes.
crying. We lost everything, mommy. And the mom was saying, No, we will recover everything, sabi niya ganun,
Yeah.
reassuring. So, a lot of it is very important. It will happen from peer support. There are people who are survivors but are strong. Nakita niyo yung bata na nag-save siya nung gabi ng 50 people. That's a living hero. So his mental, hindi siya nagpanic. He was able to save 50 people during the flash floods of Tino. Fantastic. So there are superheroes amongst us. And psychological first aid is very important skill that I think should be the same way CPR, maybe psychological first aid is very easy when we teach it. It just involves a lot of listening and a lot
Empathy.
of
Di
oo,
ba? Empathy.
empathy, a lot of
Put
empathy,
yourself,
tama.
yeah,
It's
Yes.
just a
yeah,
lot of empathy.
yeah.
That's the
There's
secret of
there's a last question from Dr. Tortona,
Sige.
Dr. Ted. Are all essential medications inclusive of maintenance provided to evacuees? So about maintenance meds.
So
Ayan, yung
no.
mga
So
hypertension,
no. Okay.
diabetes.
So that's
Oo.
why you should have a go bag.
Mm.
Because we don't provide that as an emergency. And that's the concept of preparing a go bag. The go bag should have your chronic medication. What we provide is the Campolas. Nadinig nyo na ba yung Campolas kit? For
Hindi, ano
flooding,
yun?
we use
Ano yun?
Campolas. For over the years, we've learned that the diseases common in the evacuation centers are antibiotics. So we have cotrimoxazole, we have ampicillin, ano ba yung M? Nakalimutan ko na yung M. Uh, may aspirin dyan.
Amlodipine. Siguro
Ha?
amlodipine.
Metronidazole yata. Metronidazole. Hindi amlodipine.
Hindi.
Not hypertension. Tapos yung S dyan sa Campolas is salicylic acid for the mga
Aspirin.
buni-buni at saka yung mga lumusong sa baha.
Derma.
Okay,
So,
okay.
so dermatologic complaints. So that Campolas kit is something we share to the world. Parang yung speed. Yung speed, sinare ng Typhoon Uwan. Kinuha
Yeah.
ng mga Japan. Ginawa nilang J-speed. Tapos binalik sa akin, binebenta sa akin as I-speed. Pero pinaganda na nila. But it's a Filipino invention. We have many Filipino inventions in disaster. Ang problema, hindi natin kino-commercialize. Magaling ang Pilipino mag-innovate. Even yung mga, ang tawag dito, yung mga kits, yung aming PMAT, nag-develop ng toilet yan na portable na toilet na collapsible, walang tubig. So they're able to make these things also, the engineers.
Ted, let's talk about infections because you were going into antibiotics and so on. Let's talk a little bit about leptospirosis. I mean, just from the videos, right? It's impossible to not wade in this stagnant water. What are we doing about leptospirosis? And this is not gonna come up until a week or two after, right? Right? Hindi immediate yan eh. Parang merong ilang araw na lilipas yan bago makita nating biglang parang epidemya na ng leptospirosis. What are we doing about that? Or what can people do?
Let me just talk about leptospirosis a little because when I was USEC, I was also the regional director of Metro Manila, and leptospirosis from Ondoy and all that was so high. You analyze the problem, it's a vector-borne illness. What is
Yes.
the solution to a vector-borne illness? Vector control. What is
Correct.
the vector of lepto?
Vector control.
Rodent populations. Why do rodent populations
Water.
increase? Because of solid waste
Basura.
management. You
Basura.
go around these communities na nababaha, they're also the communities na naka-open yung mga basura nila. They're
Oo.
just dumped there like a pile.
Okay.
So, ano nangyayari? It's free for all for the rats. Happy yung mga, mabusog yung mga daga, matataba.
Ihi ng ihi everywhere.
Yan din yung same communities na pag binahana, nakikita mo
Yun
yung
na.
daga, kasama mo, lumulusok ka sa baha, yung daga, lumalangoy doon sa tubig.
Okay, so
Ted,
there's the
di ba?
prevention. There's the
Oo, pero
prevention part. But how about
Yeah.
people who, what about if you have to go, you have nothing to do with the basura, but kailangan mo lumusong.
Okay, so if you napalusong ka and you have wounds, kailangan
Doxycycline.
mag-prophylaxis ka. So bibigyan niya ng doctor. You have to go to the
Oo.
doctor because doxycycline is a prescription drug. It's not an over-the-counter drug. So if you're high risk,
Yes.
meron kaming low risk, moderate risk at high risk. So if may sugat ka, lumusong ka, very important mag-consult ka. Kung ikaw ay walang sugat, maghugas ka because the leptospira dies with soap and water.
Soap and water. Okay.
So, kailangan maligo ka kaagad. Ang problema, Hindi ganun kadali yun
Kung walang
in a
tubig.
exactly.
Diba, walang
Walang bus
tubig. Ano ba yan,
facility.
mga
So,
nire-recommend natin, imposible. O,
so yun yung mga
pumunta sa
problem. So,
doktor. Kung walang doktor.
yun. Tapos, so we actually do provide doxycycline now. So,
Okay.
yung mga evacuation center, lahat yan may medical team. Half of the team comes from the LGU and half comes from the DOH. So, yung morning, ang nagmaman ng medical team sa evacuation center, DOH yung mga DTTV at saka nurse deployment program namin. I have 20,000. So, yan ang dinideploy namin dyan.
20,000 workers. Okay, before
All
we...
over the country yan.
Okay. We only have a few more minutes. But let's talk about respiratory illness. Yung ubo ng ubo. Siyempre, naulanan, di ba? Their immune systems are low and communicable disease, respiratory illness in the evacuation center. Paano naman yon?
So ang respiratory illness, maganda ngayon yung mga ibang LGU bumili nung kagaya sa Japan. Alam mo yung parang fan na tent na
Okay.
yung four-sided. So they don't combine the families very often. But to me, if it's airborne, still airborne kasi wala namang bubong yun eh.
Right.
So the key is not, number one, kung ikaw ay manager ng disaster ng evacuation center, dapat ano yan, hindi mo i-overcrowd. Because once you overcrowd, that's a petri dish for respiratory illness.
Ted, walang pupuntahan.
Okay. Pangalawa,
Push people away.
okay, so this is what happens.
Oh,
See, what happens is that all of these communities na madaming unvaccinated children
ayan.
coming
Yan.
to the evacuation center.
Yan ang
So you
problema.
are at risk for developing a measles or a rubella outbreak. So kami, preemptively, nag-MR vaccination kami. Like after Tino, tinira na namin yung mga evacuation kasi overcrowded talaga eh.
Yeah.
Oo.
Rather than have the outbreak and then tsaka ka palang mag-respond, parang nag-MR immunization ano na kami, supplemental.
Kailangan talaga vaccination.
So below 6 years old,
Mag-improve ang
babakunahan namin
vaccination.
sila. Pero
Mga
kung may
prevention
ubo, dapat
talaga, no?
ma-separate din. The
Oo.
people that are sick, either you separate them or you provide masks para hindi sila mag-spread.
So masks, no? I mean, yeah, those are
Yes.
kind of like last resort things.
Basic cough etiquette, I think, is most important.
Yeah.
And also, in some evacuation centers, hinihiwalay na namin ang pregnant, elderly in separate rooms.
Okay.
You see this in Marikina, magaling na kasi sila dito. Nakahiwalay ang elderly, which is good kasi sila yung high risk eh. Sila yung pag naubuhan sila, pneumonia ang uwi nun eh.
Correct.
So, nakahiwalay yan. So magagaling na yung camp management ng mga LGU because of our very good experience of
Paulit-ulit kasi.
paulit-ulit pagka naman hindi pa tayo
Let me
gumaling.
ask Art. Ted just mentioned children, ano? Art, how about children with special needs in evacuation centers? Because, I mean, elderly, of course, very at risk, no? Disabled persons with disability. And then how about children with special needs in evacuation centers? Paano naman yan?
Yeah. If you're going to take a look when sa statistics, well, ballpark figure na you would use for the number of people with disabilities, it's like you go at like at around 10,
10%.
12% of the population.
Yeah.
Then if you're talking specifically for persons with disabilities, that's around 1% or even as high as 1 in 31 persons in the population, adult population. So, I mean, the general population. So this is like really part of that invisible group that we have. And one of the things that I realized, because like I have a daughter who's got autism, and in her school, we started to have like a campaign. And there's really a need to recognize that when children and adults with autism and also with other disabilities are very sensitive to the environment.
Oh, to
So,
noise.
to light, to noise, to
Oo.
crowding.
Crowding to many
Yeah,
people.
and
Yes.
very
Yes.
sensitive also in terms of the routine. If you change the routine, that there could be like effects on them on how they will be coping with that. So what we are encouraging, and part of what Secretary Ted is saying, is that the go bag is very essential. So in the go bag, that you would have like a favorite toy or a favorite
Very basic, ano?
security
Very basic.
blanket for them.
Oo.
The other
Something
one, of
to play with.
course,
Yeah.
and also the security thing with them when they associate that. Then the other one would be, we're encouraging and we're still to develop that at what we call like a health passport for people with autism that will indicate like those things, their needs or what they're sensitive to. And we're, of course, advocating together with what Ted was mentioning, that they already do like in the more mature settings, that they have corners or they have sections. If there's one for the elderly, then perhaps we should have for the disabled, the ones
Right.
with special needs, that they can cope with the situation. And also the simple things about accessibility, ramps,
Right.
bars for them to be able to access those. So maraming magagawa,
Marami pang magagawa.
yeah, and
Marami.
exactly what Ted was saying is like we're working on a lot of those innovations, but I think that has to be institutionalized, and we
Correct.
don't have to go far.
Oops, we lost you, Art. Okay.
Tama siya.
Frozen.
Chips on
Tama
how
siya.
we
Frozen,
further
yeah.
I
develop.
think some
Yeah.
of what Art is saying is correct. Ang kailangan ko matrain yung mga local chief executive, yung mga municipal. Kasi palit ng palit yan on a three-year election cycle.
Yeah.
So kami sa national government, pagaling kami ng pagaling kasi nga natututunan namin yung mga lessons. So DSWD, kita nyo, hindi na
Oh.
sila nanghihingi ng volunteer to pack relief. May makina na sila
Oh.
to pack the relief goods. So ano lang yun, i-deliver na lang. So nag-evolve, pero yung at the local level, at the community level,
Community level,
we
yeah.
need to
Yep.
strengthen from
So
barangay
can I? Yeah.
captains to mayors.
Oo. Can I just go back to that, Susie? That's why yung what we want to rally around would be the concept of community protection.
Okay.
Protecting them and of course the community resident to be active and consulted in those. Now I see a very, very nice structure that Ted has with the the CHTs. And
Yes.
in each CHT, you have a very, very mature health emergency coordinators. Like
Yes.
this one recently for the earthquake and also for the floods. So I happened to get in touch with Dr. Mayan in Region 6, and they're very open in already disseminating information about what to do when children with autism will have to be evacuated. And we are going to be talking about how that can be further disseminated and exactly go to the community at the
Nice.
next stage.
Community
Yeah.
protection. Okay. Unfortunately, that's all the time we have for today.
Yeah.
I'd like to I want to thank, of course, the Secretary of Health, Secretary Ted Herbosa, who's at the helm of all of this and has been an inspiration to many in terms of uplifting our ability to respond to disasters. Dr. Art Pisigan, formerly with the World Health Organization. Stella, we have to run the panel discussion evaluation. So that's being run right now. So please fill it up. I think, who do we have next week, Stella? Okay, so please fill it up. It's asking you to evaluate the panelists and they speak clearly and audibly. Did they demonstrate knowledge? I think this is all a big yes, right? So thank you very much for filling up the evaluation. Stella, who do we have next week?
Next week we have Jubert Benedicto. So he'll be one of our speakers next week. Jubert,
Okay, so we're going to talk about respiratory illness.
respiratory
There are
illnesses.
a lot of
Yes.
people who are getting, inuubos, nisipon, isang linggo na. Ano ba yon? What's happening there? So we're going to talk about that. He's the head of the Philippine Lung Center. And before we conclude our program, all health updates webinars are archived in viewing for TVUP YouTube channel for your convenience. And I know for those who are so busy, we have some selected presentations that are featured in snippets, which are called the YouTube Shorts. So this formally brings our webinar to an end for this week. We look forward to your company again next Friday. It's a date.
Together we can stop preventable deaths.
Okay, so see you next week online.